When I transition into a 1C position here, I still get this unraveling that's quicker from the bottom up. The right foot and ankle complex has locked up at the mid-tarsal joint, relative adduction, so it's become congruent, and we have relative eversion. We have a rear foot that's inverting with plantar flexion that's allowing us to transfer that slide glide rotation, those proprioceptive input up through the right hip and to the left hip as this bottom up driver, that in 1C we continue this translation closer towards home plate and this further disassociation from the bottom up. So we have continued cervical spine, right side, left rotation and left side bend, with thoracic spine type 2 out of sync motion, right rotation, right side bend, with a significant involvement of the left hip and foot and ankle complex as we get into some inversion at the left foot and ankle complex, with, in combination, the slide and the glide anterior and lateral into the left hip, loads hip flexion, adduction, and internal rotation, so a huge involvement of the gluteal complex. And we have to have this bottom-up unwinding-like effect due to the fact that the news today in regards to all of our pathological conditions continues to show that every year injury rates continue to get worse and worse and worse. Well, a reason for a lot of this stuff is we're starting to unwind from the top down rather than from the bottom up. So we're in TZ1C here, and we're transitioning further forward, and in effect, we're loading up that lead side leg so we can, through TZ2, explode through that lead side leg and continue to allow basically the end result of throwing a baseball to be this catapult and this whip that just happens to come from the shoulder complex. So as we start to unravel from 1C and forward right here, again, as things start to unwind from the bottom up, we're having this left rotation towards home plate indeed, but again, we need to think of it from top and bottom, almost like a Christmas tree. We're going in the same direction, but at a different time and at a different speed. And so the unraveling that needs to occur to prevent pathology from occurring 100% has to be bottom up. And so we'll get into these transformational zones with a fence or with a dowel, and we'll take a look at and use those as self-mobilization and self-stabilization tools and techniques as ways to prepare us for the time in which we go out and start throwing a ball around on the field, whether it's practice, spring training, before a game, bullpen before we wind on up. So take a look at these transformational zones, take a look at your athletes and your individuals and the motion that we should be getting. This is what's normal. You're going to see a lot of abnormality, and we need to kind of get to the root of, okay, is it stability, is it mobility, is